Okay, so we are here with Max. If you remember, we put her on Instagram yesterday with her ankle. So she's in today for a follow-up, and there's still some swelling in here, which is to be expected. But what's really interesting is when we go through and test, we had to fix a bunch of muscles that stabilize her ankle and foot. But when we had her come in today, if we test some of these muscles, and she couldn't do any of these yesterday. They were pretty much very, very tender, but they all work. So one of the things I always try to keep in mind is that when you have a sprained ankle, don't just look at the ankle. You have to look at where all these muscles come up and attach, because watch what happens when she bends her knee. If we go back and retest these muscles, they all shut off again. So what happens, hold that there, is if I come back and rub the insertion of her calf muscle back here in the back of her upper leg, she can then hold them all. And so the one thing I want to be aware of is that if I hadn't checked for this, she probably would have felt better. You already felt better today, right? But this would have become a chronic thing. In other words, as soon as she stressed the knee enough times, playing on the soccer field like she does, she would have started having problems here again. But what's really interesting also is from a neurological standpoint, if I have her touch over where the nerve exits the spinal column. So I'm going to have her touch that. That also strengthens it. Okay, so this is where we want to use light therapy. Hold this here. Yeah, this is where we'd want to use light therapy to help strengthen those nerves as well as work the attachment of her calf muscle into the back of her leg. So when you have a sprained ankle, it's always in the ankle. Sometimes it's going to be in the ankle and it's going to be in the knee.